child diagnosed with gastroenteritis is admitted to the pediatric unit. Okay? Important keyword here. We're dealing with a pediatric patient. It's an 8-year-old child. Whenever they give you, okay, whenever they give you the age of the child, the age of your patient is important. Child, 8 years old. What is the child's problem? What is the child's diagnosis? Gastroenteritis. And the patient is admitted to the unit. The nurse administers prochlorperazine rectally. Which adverse effect should the nurse assess for? So now you see that the question is completely different. Now we're not talking about intended effect. Now we're not talking about side effect. Now we're talking about adverse effect. So automatically you have to go, okay, adverse effect is an undesired effect that causes a life-threatening condition and cannot be treated easily. It needs medical intervention. So, nausea, vomiting, and diarrhea, answer number 1. Tremors, involuntary twitching, and restlessness. Diplopia, ptosis, and urinary retention. And answer number 4, dry mouth and constipation. So I see some of you selecting answer number 2. I see some of you selecting answer number 4. So what is the correct answer and why? So if you selected answer number 2, why? What was the reason behind your selection? If you selected answer number 4, why did you select answer number 4? And know this trick, this strategy. Whenever you're in between two answers, write it down. And when you find the answer, the correct answer, identify if you selected the correct or the incorrect and how often that happens. You're going to see that at the beginning of your training, more frequently you will select the incorrect answer. But as your critical thinking begins to improve, you will jump into the selecting the correct answer more frequently. That's how you know your critical thinking is improving. So, what is an adverse effect of this medication? Now, what is this medication? This medication is an antiemetic drug. It's a medication for nausea and vomiting. This medication, okay, they're an important situation that you need to write down whenever you give this medication that I will discuss. So if we look at the answers, which answer you can eliminate very quickly? Which answer you can say, definitely, this is not the correct answer because it is not an adverse effect. The first thing that you can do to eliminate answer number 4 is dry mouth and constipation is a side effect seen on many medications. But I'm not looking for a side effect. I am looking for an adverse effect, a life-threatening condition. So answer number 4 is eliminated. We have answer 1, answer 2, and answer 3. Number 1 says nausea, vomiting, and diarrhea. Why is answer number 1 not the correct answer? If I'm giving this medication for gastroenteritis, I am giving it to relieve, to improve nausea and vomiting. So how come I'm going to give a medication to treat the symptoms of gastroenteritis and it's going to give me the same symptoms that I am treating? So answer number one is the reason to give this medication, compensine or prochlorperazine. Nausea, vomiting, and diarrhea. Okay? Now, this medication is not known to cause diarrhea, so this does not make sense. So two reasons why I can eliminate answer number one. Does not make sense with diarrhea, and I am giving it to treat the nausea and vomiting. Because the medication that I am giving is an antiemetic drug to treat the nausea and vomiting. So one is gone. We have 2 and 3. Tremors, involuntary twitching and restlessness, and 3, diplopia, ptosis, and urinary retention. Answer number 3, we can eliminate. Why? This medication, as the antiemetic, does not cause diplopia or double vision. That's what diplopia is, double vision. It does not cause dropping of the eyelids. And it does not cause urinary retention. What we could see is blurred vision, not diplopia. So answer number 3 is eliminated. The correct answer is number 2. Tremors, involuntary twitching, and restlessness. Now, remember, I said at the beginning that you have to watch for an adverse effect that you could see on patients that we give prochlorperazine. There is something called extrapyramidal reaction, extrapyramidal effect. When we give this medication, an adverse effect of this medication is an extrapyramidal effect, which includes tremors, involuntary twitching, and restlessness. So answer number 4 is an adverse effect of the medication. That is the correct answer.